Hello and a very warm welcome to you all. I'm Vikas Nangia with Focus Live Season 5. Ladies and gentlemen, my guest today on the program is a renowned senior plastic and cosmetic surgeon who's visiting from Vadodara, Gujarat, Dr. Sandeep Sharma. Dr. Sharma is the former president of Indian Association of Aesthetic Plastic Surgeons. He's here in the country on a special mission to raise awareness on the plastic and cosmetic surgery. He's an expert also on reconstructive surgery. Dr. Sharma, thank you so very much for joining us on Focus Live Season 5. I'd also like to bring to the attention of our viewers that Dr. Sharma has conducted over 10,000 surgeries and understands the art and sciences of plastic and cosmetic surgery very well. He's trained and learned in United Kingdom and Australia. He's been practicing for the last 26 years. And more importantly, he's also the founder and director of Aesthetique Center. Dr. Sharma, once again, welcome to the program.
Thank you, Vikas.
It's a pleasure to interact with you with such a incredible journey that you've had in the area that you've been practicing as a surgeon. For the viewers' sake, from the very beginning, I would like to lay the foundation for them and make them understand what really is the difference between plastic surgery, cosmetic surgery, and reconstructive plastic surgery.
Yeah, thanks, Vikas. Yeah, it's been a pleasure here coming to New Jersey and sort of meeting you guys. Basically, plastic surgery is the all-encompassing specialty. Plastic surgery has got basically two parts, the reconstructive and the cosmetic. Now, reconstructive surgery kicks in whenever we want to kind of get a person back to normal, right? So any injury, any burns, any surgery is done, whatever, whenever there's a deformity, we correct that and get that person to normal or as close to normal. That's reconstructive plastic surgery. And when we have situations where a person is inherently normal, but we want to kind of get that person to get a better version of himself or herself, or wants to sort of get rid of something which he or she is not happy about, that's cosmetic surgery. So we're dealing with fit normal people, that's cosmetic surgery. We're dealing with a problem and solving it is reconstructive surgery. And all that together comprises plastic surgery.
So in a layman words, I would say that reconstructive is more basically accidental, which basically people come across any kind of a tragedy in life. And cosmetic is of course more of a choice that people develop.
True. Yeah, to some extent it's choice. We'll dwell on that in a moment. But reconstructive is not only accidents. It can be a birth defect. It could be injuries. It could be post-cancer, like we do breast reconstructions, or mouth cancers reconstruct. So basically integrating or getting that person back into society.
Let me understand, as I said, certain surgeries you need to, which is in form of reconstructive, and there are others which are cosmetic and which people do it out of choice. Now, both require a mindset. How do you prepare the patient for a treatment like this? Yeah,
well, it's sort of both easy and difficult. Easy as in, when we talk about the reconstructive part, we really know it's defined what the problem is. So we just got to articulate, understand the patient or the problem, and also explain to the patient as to what they should expect as outcome. And that's where experience and training come into the picture. That the person really knows before the journey, the surgical journey starts, as to what to expect. And that sort of also cuts down a lot of interpersonal or doctor-patient relationship problems, what have you. So that's important. The second part is that when we talk about what to expect in terms of cosmetic surgery, there again, there may be reasonable requests, there may be unreasonable requests. So a good doctor would very nicely avoid operating on people who've got unreasonable requests. Yeah. So, but yes, say for example, somebody's always had a bent nose. Now every photograph, especially if they are in the front end of operations, that's what gets noticed in every photograph. So getting that corrected may be vanity for a third person, but it's actually really not vanity. It's essential for that person, because he's going to see his face or she's going to see her face every day in the mirror. So if you see a better version of yourself and you're happy, you're going to perform better in life, not only at work, in personal relationship, what have you. So actually, many times, that's why I said it's not necessarily an, a vanity procedure.
Before I open up the conversation to talk about the various popular forms of cosmetic and plastic surgeries. These days people go for body sculpting, hair restoration, breast surgeries, augmentation, and so much more, and that's your expert area at Aesthetique Clinic. You mentioned about the association for which you've been the former president. What's the mandate of this association, which is the Indian Association of Aesthetic Plastic Surgeons, and how do you folks keep up with the synergies at the international level?
Yeah. Well, as the president, I became a president, just after or during half of.
And I believe you were the first one to become the president from Gujarat, right?
Yeah, that's true. Yeah, that's a matter of pride, actually. So, yeah, basically, I became president during the COVID times, or just after the COVID times.
So, yeah,
the tough times, actually. And it worked for some people because, people were free, they wanted procedures done, use the time.
Right.
And others sort of, because they were shut out, they had no work to do. So it worked differently. Yeah, but as the president and as a society, our aim is to kind of twofold. Number one is the key is that we make sure that we improve patient care.
Right.
So we have a mandate to help society, or sort of be part of society and get patient care better. So we train our doctors, make sure that they get adequate training, they get adequate mentoring, because any surgical branch is sort of a learning curve, and there's no shortcut to experience. So the more surgeries you've done, and the more audit you do of your work, that's how you're going to get a better surgeon. So we sort of help it along, so to improve the quality of patient care in our country. And that's made dividends. That makes a difference, because my team, the colleagues are really standing out on the international stage. Secondly is also to try and get new technology, new techniques into our country. So we have credible people teaching, the latest techniques. So we are fast-tracking learning as well. Mm-hmm. So those two things, and coupled with that, my personal sort of journey was to increase the presence of Indian plastic surgeons worldwide, and really enhance our position on the world stage. And I'm sort of happy to report that I've managed to do that to quite a big extent. And that was sort of also one of the things that during we had this the 75th anniversary of our Independence Day, and I had messages from around 35 countries, 45 leading plastic surgeons sending in video messages congratulating India. So sort of building a bonding around the world was also a big deal.
Let me talk to you about some of the common plastic and cosmetic surgeries. And what I commonly hear from people is it's all about body sculpting. Hair restoration seems to be very, very common. I see individuals as young as 17 through 70 going for that treatment. Is there a particular age that you should not go for it, or should stop? So there are several questions. I mean, I could have gone in for series on each of these topics.
True.
Let's just try to break them up a little by little, and obviously on the other side of the break we'll try to get a little bit more in details and get more in depth. But let's talk about some of the common cosmetic surgeries here.
Yeah, well, cosmetic surgeries, if you asked me a very broad question about what are the common procedures, I would divide it into surgeries which are sought after by women, which are sort of the majority, or sort of 70 to 80% of our clients or patients, if you like, and men. So that's sort of so different. And again, there's the age group, the younger age group, and the older age group. So when it comes to women, the commonest procedures sought, and especially sort of in India and in my practice, are post-pregnancy related body shape or body issues. Mm-hmm. So liposuction is very common. It's a safe procedure if it's done in a good setup with an experienced surgeon, and also tummy tuck, which is especially with women who are into fitness. Mm-hmm. They are very fit, but still they haven't been able to get to the shape they want. That's basically because of hormones at play, age-related issues, which are sort of, or food-related issues which they had in the past, which prevent them from being their best. So we come up with what we call as high-definition body contouring procedures, and that's very popular. Again, breast surgeries are quite common. We'll dwell in depth about that in a minute. And so that's about the women. As coming to men, yes, hair transplants become a very common procedure. Initially, people used to hide the fact. When I started practice, they would wear a cap going around after a procedure and would not come out till they were. Now people are very open about it because society's got very short memory now. People won't even remember if you had a transplant or not, and you can see results within a few months. So it's pretty good that's done. Second thing for men, very common, is what we call it the male breast, also called gynecomastia. So that again is something which they look at. Men hit the gym, or for fitness you see people running around, and still if they have issues which do not get you back to perfect shape, that's when a plastic surgeon is called into play.
Viewers, we're going to take a quick short break over here. We'll be right back after these messages. Dr. Sharma, once again, welcome to the program. Prior to the break, when you were answering my last question, you mentioned about the common form of surgeries which are found between men and women, and you sort of spoke about women, about the liposuction post-surgery, you spoke about breast surgery, and then while speaking about men, you mentioned about hair restoration and about male breast as well. I have seen a mix of both in women as well. I've seen women also losing their hair because of the hormonal menopause and so many other issues. So even women are now open for hair restoration. Some are vocal about it, some are not, because it's still a taboo in our society. And of course, male also sometimes feel very uncomfortable talking about their male breast. And so here we need to raise a little bit of awareness of all these things. Of course, keeping up the time constraint, as much as widely you could explain our viewers, because you practice all these, you've done over 10,000 surgeries, so there's a lot of experience behind you. What are some of the myths and the facts that the viewers should know, some of the pros and cons related to these surgeries? Your
question, I could break that up into parts, and you can add wherever you feel like about the number of procedures you asked. The commonest, I think, which is sort of seems to be quite close to your mind or heart, whichever way you take it, is about hair restoration. I have a presentation which I give to social groups, and that's part of my sort of Society Connect initiatives, where I talk about the talk's called Holding On to My Hair. So this is because I see more and more people seeking that, and as you very rightly said, right from 17 people are wanting it. Yes, quick retort to that, I would not consider anybody for a hair restoration before 22, which was 26 when I was in training. Right. But I do definitely say that that doesn't mean that you wait till 22. There's so many things which you need to do to prevent hair loss, to kind of get the recent hair lost back again, and that's got to do with certain supplements, certain medications, and very importantly, changing your diet pattern. So that's what I would sort of advise for the non-surgical aspect of hair restoration or hair loss management. Yes, again, hair transplant I do both for men and to a lesser extent in women, and it's a very satisfying procedure, very clear procedure. The only thing you need to know is that you should be doing it with an experienced surgeon and in a good setup, which people in this today's social media world, what people project out and what the reality is. So you should do your background check before you're doing that. Just don't do it because the next door guy has done it. Right. That's not the best way to kind of go ahead. Right. But yes, so hair transplant gives you good results.
Pardon me, before you really jump on to the next form of the surgery, you mentioned that today, of course, you suggest that one shouldn't go for the hair restoration before the age of 22. Earlier it was 26. But also draw the cap for me till what age one should get it. I've seen people even in their late 60s or 70s going for this. Till what age they could do it?
Yeah, well, as I said, I have, I do get an occasional patient in the late 60s who is wanting to get it done.
Right.
Yeah, and yes, I've done 75 or 76. That's the sort of the oldest which I've done. Yes, but and see, these are fit people's procedures.
Right.
So especially in the second half of life, if you're getting it done, that means your life's well sorted. Everything, all your boxes are ticked, and you think you want to be a better version of yourself. So why not?
So you mentioned about when we were talking about hair restoration management, you also mentioned about, and And this is why I'm speaking more and more, because you see a lot of times when people are losing their hair, they talk about the lifestyle that we are in these days. They talk about stress, anxiety, depression. There's so many factors. You mentioned about supplement over here. You mentioned about the diet over here. Can you give some insight on the supplement and the diet as well?
Yeah, well, to give you that's sort of a very long topic. It can be a conversation in itself. Yeah, but I think the key message, if I want to give your viewers,
to get as much as possible.
True, fair enough. So the key message which I would like to give the viewers over here is that it's not rocket science. You got to understand that why is this happening. You know, we just don't chase the effect. You got to chase the cause. कारण समझो आप. तो कारण नहीं समझेंगे तब तक आपको आपको holistic या long term outcomes नहीं मिलेगा. So this has got to do with there's some deficiency or there's a trigger. The trigger usually nahi hota hai because we are living in good environments. There's not that much pollution in terms of exposure to toxic chemicals or whatever. But yes, the input, the stress and all that is important. But then, to lose hair in a permanent way, it's got to be an extreme degree of stress. सब लोग सोचते हैं मेरे को सबसे ज़्यादा stress है दुनिया में. It's not the reality. So that is important, but not the key. More important, I think, is the food which we take, because यहाँ का I cannot be an authority to comment, but yes, in India, more and more food is adulterated.
Right.
So you may go to the best shop, you may put in the top dollar for that, but still the quality of food you get may not be right food. Even the organic foods, which is the best food, may not really be organic.
Right.
So that's why you miss out on the vitamins, you miss out on certain minerals, and that's why it leads to all these things.
But
so I don't want to get into junk food wala issue, because that can be emotive, but those are really the cause. So आपने अगर अपने 5-year-old को आपने गलत foods खिलाया है, so rest assured आप मेरे लिए एक patient तैयार कर रहे हैं 25 पे. So my advice to parents is start young, get them eat right, so then they don't have all these issues.
Obviously, the food part can be a conversation for some other day, but we wanted to make viewers understand that food is something that can play a pivotal role in what your health condition is. And it could be any kind of health condition, any kind of illness. Many people also talk about that they tend to lose hair at a certain age when they have multiple health conditions, and more specifically when they have a thyroid issue.
True.
What would you say?
I agree. See, thyroid, diabetes, and these are sort of significant triggers of.
And while individual has these issues, you still treat them for hair restoration?
See, again, it depends upon how healthy they are. A well-controlled diabetic or a thyroid controlled patient is per se a normal individual on medication. So if that is an issue, yes, we would definitely look after. But I would make sure that the person is fit and healthy to undergo the procedure.
Okay.
Right. So that's sort of the cue that you take onto.
Let's talk about breast surgery, which is very, very important. 2 reasons. One is sometimes it is for the reconstructive purposes, and sometimes it's for the cosmetic purposes. Reconstructive, where most of the times I'm bringing in the reference of the cancer patients who've gone through chemotherapies and gone through some major shock of their life. And so that for them to feel very normal in the society, they go for this reconstructive surgery. Make us understand what's the procedure for the cancer patient as part A of my question, because sometimes they're in a remission phase. Should they get that surgery done when they're in remission, or should they wait for the 5-year cap when they're totally out of that cancer treatment in their life?
Yeah, well, I'm glad you're putting it so succinctly about the question about breast cancer. Yes, to me, a reconstruction or getting a breast back after having completed treatment, that is sort of the final step of reintegrating a person's victory over cancer. So I think that's very important that a reconstruction should be offered along with the cancer surgery. So it's not a question of whether you wait for 5 years. You have both options. Do it immediately.
So it can be done simultaneously?
Yes, absolutely.
Wow,
very few people do not qualify for that, but that a good oncologist will always be able to guide you. But yes, each ideally should be done at the same time. So you go in with for a surgery, you get the breast removed, have a new one put in. So you can imagine the psychological impact and the confidence it gives that woman. So you got to understand that the breast is the symbol or organ of femininity.
Right.
Right? So losing that is akin to a woman losing a part of her identity.
Right.
Right? Some women may be strong enough to handle that. Some relationships, some couples may be strong enough to handle that. But by and large, we got to take averages here. It is very important for a woman's life.
Right.
Yeah. And why live in a disadvantage when you have the options for being comfortable? Right? So that's how I would take it.
So Dr. Sharma, also when we are talking about femininity and we are talking about breast surgery, and as I said, part A, of course, was related to the reconstructive, the other cosmetic part of it. Now, some would come to you for enlargement, the other would come for the reduction as well. What are the parameters? Do you keep the body mass index in consideration, or how does that go? Because somebody might just say that I want a certain size, which might not be good for their health in the long runs.
True. Yeah, again, very pertinent questions. Breast surgery, yes, it can seem paradoxical. Why is something coming for more and why is some coming for less? And in fact, even women, the one who wants a reduction will not understand why somebody wanted more,
right,
and vice versa.
Right.
Well, yes, there are parameters which guide us as to who we should do what, and but it's sort of pretty much a semi-social decision as well. So I'll talk about breast reduction first, because that's sort of a procedure which I do a lot of, which I have been blessed to be able to go and do workshops. I do teaching, surgical teaching, do operative demonstrations to kind of get it right, because again, as I said, it's a very important organ. You got to get it right. A good procedure or a good outcome can be the make and break, not only for the reasons done, but for a relationship as well often. So I take it very seriously, and we are doing a surgery in lying down for an outcome which we want in standing. So it's technically quite demanding as well. And we're doing it for a normal person, so there's sort of no margin for error allowed as you see it. And so these women, the breast is so much larger that it's affecting their lifestyle in terms of physical activity. I have women who would not want to go swimming because they can't, because they just don't want the unwanted attention.
Correct.
Right?
Correct.
And you have women who's, after in a procedure, I've taken off, like 1.5 kilos per breast. So like 3 kilos you take off, and still at the end of procedure, they are a big C cup or a D cup size. So I'm not making them smaller as in flat, but at the same time, you can imagine the relief it gives them on their shoulder, on their upper back, and they have a postural improvement as well.
And especially that could have side effects at the old age.
Absolutely. So, you're looking at arthritic changes, you're looking at lesser mobility leading to sort of changes in the lower body, lower joints as well. Right. So it has got significant connotations. In fact, I'll give you a very interesting story if you have time, to tell you. I had this lady recently, I did a procedure on her, a breast reduction procedure for, and she was slated for a spine surgery because she was having a nerve which was impinging and it was leading to sort of weakness in her lower limbs. So, but because of the time factor and the pain involved in the spine surgery, she said, let me do this first.
Right.
And because of this surgery, she had to only lie down on her back. She could not turn postures for a 10-day period, when it gets the scars to heal. And you know what, lying on the back, it sort of decompressed her spine. And she ended up with relief of pain, and she does not require a spine surgery.
Yeah. While we're talking about breast surgery, Dr. Sharma, what would you advise to new mothers? Can they go for breastfeeding? Because if they've had any surgeries related to the breast and then they've delivered a baby as well, how does that work?
Yeah, well, again, very pertinent questions. I'll ask this first and then take you on about breast augmentation. Well, yes, you can breastfeed after surgery. With following a breast augmentation, definitely the route which you take to put in, enhance the breast has got no issues with, damaging the breastfeeding system. With breast reduction surgeries, yes, there are a fair few scars because we've got to sculpt the breast back to a good size. And some people may have an issue, but majority do not. But that's a rider, because I find that almost 30 to 40% of very large breasted women can't breastfeed anyway. So we are doing them a big service by, getting the breast reduced so that they can at least function normally. So, yeah.
when we talk about these kinds of treatments here in America, and if there was an American doctor on my program, I would have touched upon different ethnicities as well. Now, you are practicing in Vadodara, Gujarat, and obviously your patients are, majority of them are Indians. You would have NRIs come to you from, from USA, Canada,
Absolutely.
Australia, London, but they are of Indian origin, right?
True.
Here, of course, I would have asked to a doctor, maybe, of an African American or different ethnicities I would have touched upon, Spanish American, Indian Americans or so. What are some, if now we are categorically talking for our viewers who are, majority of them are South Asian Americans, Indian Americans, what would be your advice? Does ethnicity in any way play any role for any of these surgeries?
Oh, well, big time. It plays a big role in, because it plays a role in a mindset as well. And plastic or cosmetic surgery is actually a surgery of the mind. We'll dwell on that in a bit. Yes, it does. Let me kind of break it up for you. Let's talk about Indians, and then we have, sort of Indian Americans, or maybe NRIs, depending upon the status.
Right.
So, yes, our skin type is quite different. Our skin handles and scars very differently from the average Caucasian patient which you have over here. So you need to know where to put the incisions, how to stitch it. There is a difference. So obviously, me dealing with 95% only Indians, our understanding of that issue is obviously much more better and higher than otherwise.
Right.
So yes, and not only that, even decision making. Basically, because I travel a lot overseas, all around the world, I know exactly what a Brazilian patient wants from my colleagues in Brazil, what a Middle Eastern wants, what a European wants, what an average American wants, what an Indian patient wants. And, it's that's a social comment actually, is that in India, we don't waste money. No
Nobody
Indians
likes
ever.
to.
No, that's wrong. See, people will do it for, I take it differently because coming from my American colleagues, I know, depending on the expectations. But we always want value for money. So any cosmetic surgery also, which people take it as a surgery of vanity, which is not, at least in India it's not, there is a reason why they do it. So to give you an example, if you're talking about breast surgery, say for example a breast augmentation, many younger patients, because we've got sort of categories of 25 to 35, they would often be doing it for matrimonial purposes. Because you are in the matrimonial sort of subset or whatever. Yes, no, they are significant. They're significant. So that sort of is, you're doing it so that you improve your prospects of matrimony. So there's a reason behind it, and obviously success in surgery means success in matrimony, means success in life.
We'll take another short break over here, but before I lead to the break, here are some of the important messages from some of the other doctor friends of Dr. Sharma who live in this part of the world. Listen to them, what they say about Dr. Sharma.
I'm a physician who's practicing in New Jersey, accompanying Dr. renowned plastic surgeon Sandeep Sharma for past few days. I know him for a long time, for more than 10 or 15 years, as well as we have mutual patient who has been in Baroda and operated, and the outcome is very successful. Dr. Sandeep Sharma has a significant qualification and achievement, which I do not need to mention, has been mentioned earlier. He's a person who does the job very precisely, very clean. His office is located in Baroda, which is very clean and neat, which I have not seen some kind of neat practice or office in United States itself. I wish him all the luck for his tour and success, and I'm thanking TV Asia to give me the opportunity to say a few words. Thank you.
We'll take a quick short break over here. We'll be right back after these messages. Welcome back. You're watching Focus Live Season 5. I'm Vikas Nangia. Ladies and gentlemen, I continue to be in conversation with Dr. Sandeep Sharma, a renowned international senior plastic and cosmetic surgeon from Vadodara, Gujarat, who's here in the United States at the moment. Dr. Sharma, once again, thank you so much for joining us on Focus Live Season 5. So we've discussed many of the treatment procedures and how important and how it builds up the confidence in an individual who's going through any kind of dilemma, doubts, stress, whatever be the reasons. Commonly found these days, and men are very conscious not just about the hair, we've spoken about that part, but is also about the male breast, everybody wants to look like, popular Bollywood actors, and they want to be out for their holiday destinations in their swimming trunks, but they're very conscious when they take their shirts off. What would you say?
Yeah. Well, what you're referring to as male breast, also called gynecomastia in medical terms, that's an increasing issue. Some procedure which I used to do sort of 1 in 3 months, I'm sort of almost doing once a week or even more. So that's so there's sort of two parts to it. Should I do it? And second is, why is it there's an increase in frequency of these
and pardon
cases?
me, just allow me to jump in here and add something more to my question. Is it more to do with genetics, hereditary, or is it only because of the habits that we develop over a period of time?
Yeah, well, the final verdict's still out, not yet out, so I wouldn't, but looking at the case mix, at least in India, I find that there has to be some hormonal basis as to why, I get perfectly fit young boys who are doing the gym, who are doing their diet thing properly, as in, eating the right kind of foods, they're not eating junk food, and still they're having it. So I feel that they're being shortchanged at some stage. And that's where I feel that there's some adulteration in the nutrition which is causing that. I mean, it could well be something simple like, oxytocin, which is a milk producing hormone which people may be injecting in the cows when they milk it, so that comes in the human chain, and that again stimulates the male breast to become bigger, because you're also finding young girls which breasts which are way bigger than what should be at their age. So there has to be some adulterative issue which society should as in a bigger picture look at why it's happening. But there is an issue with that. So that's what it is. Yes, there are almost 30% who just put on weight. They eat the wrong things. They're very obese. Blatantly obese. So they sort of, there's no love lost for them, but yes, they have a problem which needs to be dealt with. But as a doctor, would I operate on them? Pretty much yes. So this is one of the very few surgeries where I would say yes to most of the people who approach me, because of the reason that whatever exercise they do, whatever else they do, this is not going to go away. So either they'll accept it, or they get some surgical procedure done for it.
And I've commonly heard people going in for it between the age of 20s till mid-50s or something like that.
Yeah, the youngest I've done is 17 years, right. But yes, so usually late teens, 20s, if they have an issue, it's not going to go away. If it's sort of what we call as grade 2, grade 3.
Yeah. Dr. Sharma, I also want to talk about ageism, which is a very commonly talked topic these days in America. And when I say ageism, it's about two folds. One, there are people who would look more than their age, they would look overaged. And there are others who would also look underage also. That's also another problem. There's some people do not look of their age. You talk to the human resources people, everybody wants their employee to look sharp, dynamic, personality-wise when they're representing their company. But the problem is sometimes, even though they have the sharp brains, they lose the opportunity because they're not looking sharp with the personality that they carry, and it's because they're looking overaged.
True.
And is there an advice from a plastic and a cosmetic surgeon who's experienced in this area? What would be your advice to these individuals?
Yeah, well, advice twofold. Yes, that's a real issue, and everybody should address that in their own way, so that you don't get into that box situation that you need to get something done about it. But yes, advice is twofold. Number one is preventative. Basically, most of the damage to the face is obviously from sun exposure, and the second is the diet that you have and the lifestyle that you lead. You need adequate sleep. It's very important. So because the face and your skin is a representation of your overall health. So people want to look healthy, and even if they're not, or they're healthy but they have an issue which should be treated. So doing that is important. As to maintenance beyond a certain age, you require certain creams. It's like if you give an analogy to a car or whatever, with time you need more maintenance. If you don't, then you're going to have problems faster. So you should use certain good creams. You need certain supplements which are missing in your diet, because we tend to follow that same diet which we've been having for the last 20 years as force of habit or circumstance. So that's important. So skin creams, skin care, protect yourself from the sun.
So are the creams
those are
that you're
important.
referring, are those the OTCs, like over the counter, or the prescription creams?
Those depend upon the degree of
Situation to
damage you
situation.
have.
Okay.
Yeah. So
All
if you got more damaged skin, then obviously you should be getting something which is more potent, and only then you'll get some effect. But if you're sort of just maintaining you're already good, then OTCs are fine, because no OTC can be strong enough to give you a result beyond the average.
And slowly, gradually, as we're coming towards the end of our conversation, I also want to get your thoughts on Botox and fillers, because that's very popular these days with mid-aged, I would say even with teenagers, you know, with fillers and all that.
Yeah, teenagers a bit early, but yes, in the late 30s, you know,
From
that's when
mid-20s, I would say that's
right.
getting very popular these days.
Correct. Yeah, well, fillers, as the word indicates, fills in whenever there's a defect or there's sort of a volume deficit which you think you would want to fill it with.
Right.
So that's sort of, you know, it's popular. It's a simple thing. You know, you just need a person who's technically good at you know, knowing his anatomy as to where and how much should be put in. So you want to have it just right. Too much more makes you funny. Too much little does not give you the result. So
Right.
that's important. So it's a pretty straightforward procedure, but should again be done by a trained person. You know, every 10th person ends up with a problem because they don't go to the right person, and the procedure gets a bad name. So it's not the procedure, so it's not the car, it's the driver who's bad.
With you, I've also seen the fact that you are reversing the traffic. You know, when people in India think of going abroad to get these kind of surgeries, they are thinking of US, Canada, you know, Australia, even going for their hair restoration to Turkey and all that. Dr. Sharma is reversing the traffic. He's having a lot of NRIs come from these countries.
No, don't get me wrong. I'm not reversing traffic at all. That's not my idea. In fact, I'm here in the US because I've got a lot of people who, you know, what I would call as ex-patients who are now become like friends or even family.
Right.
So they've invited, and so I'm here sort of on a sort of social trip, if you like, and that's
Right.
always fun. So I don't reverse traffic. I'm not here to sort of get there kind of thing. It's just, you know, when they're there, you know, that's sort of what we have available. Yeah, on that one point I sort of wanted to also tell you, which is, you know, what's latest in our field when you're talking about face. So we're talking facial rejuvenation, and especially with the corona thing and, you know, people being more in front of camera, more on Zoom calls. So that's important. So yes, it's important to look your best. So you want Botox, fillers to kind of complement or, you know, so take away any final blemishes which come up. And as you said earlier, ages means as in you don't want it to be too bad before you do something about it, sort of catch it early so it becomes semi-preventative. So that part you know, is there. But also we are doing a lot of skin rejuvenation in terms of using stem cells. So fat in our body is a storehouse of stem cells, and we all have some excess fat to give, right?
Sure.
So we use that, take that out, you know, process it, take some stem cells and inject, you know, on, say, for example, the face, which is a common area. So you've got your own things, which is an immune booster, so to improve your skin quality, which will happen over a period of months. So that sort of is the latest. It's going to get finer and better as time and technology improves, but that's sort of what we tend to do, and it's a good thing to have, because, you know, at all stages we've never had the chance to give ourselves our best. We give others the best, the company the best, the people the best, but we don't look after ourselves. So there's lacunae which we missed out on. There's time to sort of make up on that.
So this is interesting that you folks are making utilization of the advancements in the stem cell therapy, which is fantastic. Dr. Sharma, it was a pleasure interacting with you on Focus Live Season 5. Thank you so much for the insight, and I'm sure viewers are going to be at most advantage. It must have been a learning experience for them. Thank you so very much for joining us on Focus Live Season 5.
Thank you.